So we have your basic care and comfort, psychosocial integrity, followed by health promotion, maintenance, safety and infection control, and management of care. Okay. Among all these things, we have the maximum weightage for your pharmacology, management of care, infection control, health promotion and maintenance. So these are your big topics that you need to study for your exam. Okay. Afterwards, we have in your safe and effective care, you have management of care. So these are all the topics that you need to study for your management of care. Can anyone, do you know what do you mean by management of care? Like management of care means simple English, but I want to someone explain maybe. Management of care.
Managing the procedures.
देखो, जितना भी हमने आज तक MSN पढ़ के आए हैं ना, ये सारा का सारा मैनेजमेंट ऑफ केयर के अंदर सिंपल, ठीक है, कि क्या एडवांस डायरेक्टिव होता है, क्या लिविंग विल्स होते हैं, ठीक है, क्या राइट्स होते हैं, रिस्पेक्ट योर विशेस, असाइनमेंट, डेलीगेशन, सुपरविजन, अंडरस्टैंडिंग एप्रोप्रिएट डेलीगेशन. फॉर एग्जाम्पल, अगर एक RN हो एंड आपके साथ एक LPN है एंड आपके साथ एक UAP है, तो अब कौन सा काम LPN को दोगे, कौन सा काम UAP के दोगे, यूपी का क्या काम होता है, एक RN का क्या काम होता है, आपको पता होना चाहिए. ठीक है, हॉस्पिटल में आप अकेले काम नहीं करते, देयर आर सो मेनी पीपल हु आर वर्किंग विथ यू, सो यू शुड नो कि उनका काम क्या है. अगर उनके काम के बारे में आपको नहीं पता, देन यू विल नॉट एबल टू करेक्टली डेलीगेट योर जॉब टू अदर पीपल. ओके, एथिकल प्रैक्टिसेस क्या होता है? व्हाट इज एथिकल प्रैक्टिस?
Patients' legal rights.
वेरी गुड, एथिकल प्रिंसिपल. फॉर एग्जाम्पल, अगर एसिस आप अपने नाम बदल लो, अदरवाइज आई विल जस्ट कॉल यू एसिस. सो इफ
Try
एसिस
next
वाज
time.
वर्किंग इन अ हॉस्पिटल, ठीक है, अगर एसिस से काम कर रहे हो हॉस्पिटल के अंदर एंड एसिस ने देखा कि उनका जो दोस्त है, फॉर एग्जाम्पल RN शर्मा, ठीक है, RN शर्मा जी ड्रग्स चुरा रहे हैं इन्वेंट्री से, तो एज अ रिस्पॉन्सिबल RN एसिस क्या करेंगे? सारा का सारा किसमें आता है? ये लीगल केस बन गया ना. आप हॉस्पिटल से ड्रग्स चुरा रहे हो, तो ये लीगल इशू है. आप कैसे रिस्पॉन्ड करोगे? ठीक है, एज अ नर्स आप क्या करोगे? यू शुड नो अबाउट दिस थिंग. नेक्स्ट, की अगर आपके पास एक पेशेंट है जिसके जो वायलेंस सफर कर रहा है, देन हाउ विल यू डू दिस थिंग? अगर आपके हॉस्पिटल में कोई ऐसा लीगल केस हो रहा है, देन हाउ विल यू मैनेज दैट लीगल केस? ओके, नेक्स्ट इज योर interpersonal communication, referrals, prioritization. Next is your safety and infection control. बहुत बड़ा वाइड टॉपिक्स है. वी विल स्टार्ट विद दिस टॉपिक ओनली, कि क्या होता है स्टैंडर्ड प्रिकॉशन. ओके, अंडरस्टैंड, ये पूरा का पूरा यूनिट ना आपको डायरेक्टली CDC पता है सबको? व्हाट इज CDC? सेंटर फॉर डिजीज कंट्रोल. जैसे WHO होता है, वैसे CDC गाइडलाइन. सो जितनी भी CDC गाइडलाइंस आती है ना, यू नीड टू नो इन ऑर्डर टू पास दिस सेफ्टी एंड इन्फेक्शन कंट्रोल. ठीक है, आपको CDC गाइडलाइंस पता होनी चाहिए. क्या रिसेंटली चेंजेस आ रहा है CDC एंड WHO. ठीक है, आपको सारे के सारे स्टैंडर्ड प्रिकॉशन, PPE, एसेप्सिस, इन्फेक्शन हैंडलिंग, इमरजेंसी प्लान, इंजरी प्रिवेंशन. नेक्स्ट इज योर हेल्थ प्रमोशन एंड मेंटेनेंस. इसका मतलब क्या होता है? सुष्मिता, शशिकला, जुलियाना. रूपा. व्हाट डू हेल्थ प्रमोशन? आप किसी का हेल्थ कैसे प्रमोट कर सकते?
It's regarding the lifestyle and the
हेल्थ प्रमोट
culture practice and all.
देखो, समझो मेरी बात. मतलब इसके अंदर आपको ग्रोथ एंड डेवलपमेंट पता होना चाहिए. हेल्थ को प्रमोट करना है हर एक लेवल पे. अगर वो बच्चा है तो कैसे उसको डेवलपमेंट माइलस्टोन, इम्यूनाइजेशन, एंटीनेटल पोस्टनेटल केयर, डिजीज प्रिवेंशन, कल्चरल प्रैक्टिसेस इन हेल्थ. फॉर एग्जाम्पल, अगर कोई पर्सन है जो मुस्लिम है, तो वो बीफ नहीं खाता, तो क्या आप उसको जबरदस्ती बीफ खिलाओगे कि नहीं नहीं खाओ, ये तुम्हारे हेल्थ के लिए बहुत अच्छा है? बताओ, करोगे रूपा जी?
I can't understand Hindi.
Okay. Okay, there's a person who is Muslim, and he do not consume
Alcohol.
so what you will do? Will you force him to eat?
No,
No, you will not force him to eat. Simple.
we'll change the tray. Like we'll change the meal tray, meal plan.
No, we will not provide them with non-veg food. Okay. Next is this is what you should know about. You should know about different cultural and their different practices all over, because if you're living in country and there are so many variations of cultural that we have, so you cannot just implement the same dietary habit which have been in like for a different, like for Hindus there should be different diet, for Muslim there should be a different diet, for a person who is kosher there should be a different diet, non-kosher should be a different diet. Okay, next is your psycho. What do you mean by psycho? Psycho comes from the word called psyche. Psyche means your mind, your brain, your behavior. Then is your social. Social means the society and the integrity. How your mind, how your society is integrated together, and how will you respond to some questions. For example, if there's a person who has been abused, what you will do? How will you settle down the patient? How will you? What are the steps, and how will you talk to them? Next is your anxiety. What is your grief? Okay, what is grief? I want to know about your end. What do you understand by grief?
Kind of sadness.
Grief is
Followed
sad.
by denial.
Yeah, very good. I want to know about this more. You said the word denial. Can you tell me about a theory which you have been studied? I think Kobler-Ross theory. What does Kobler-Ross theory says? What does Kobler-Ross theory state? DABDA. Can you just break down this DABDA for me? Anyone in the class?
Denial, angry,
Very good. Denial,
bargain,
anger,
bargain,
bargain, depression. Next is your.
depression, acceptance.
For example, if there is a death in a family member, the first and foremost expression of a patient will be denial. कि ऐसा नहीं हो सकता, उसकी death हो ही नहीं सकती है. Next, you will become angry, you will shout, you will scream. Next is your bargain. You will go to the God, you will say कि भगवान मेरी जान ले लो, इसकी जान छोड़ दो, मैं आपकी यहाँ पूजा करके आ जाऊंगा. ये मन्नत मान लेते हैं हम. Then is your depression, and then is your next is your anger. Then in NCLEX you should know about grief, how what at what stage what you will do, how you should know which stage the person is in. Next is very important, that is your depression, sign and symptom of depression. Next is your suicidal prevention, coping mechanism, crisis intervention, and therapeutic. We are going to discuss all those things. I'm just giving a brief about it. What are the syllabus that comes in NCLEX? What are the things that we need to know before you appear for your NCLEX? This is the guidelines strictly from your NCBS, straightforward. Next is your physiological integrity. What you must have heard about this term, anatomy and physiology. What do you mean by physiology?
Geology means functions performed by our body.
I'm so sorry, I can't hear you. Please be.
Physiology means functions performed by something or in our basis in by our body. The functions performed by our body.
Yeah, the functions. For example, there is a physiological process of digestion. How the digestion is occurring. If you talk about anatomy is your GI system, and physiology is digestion, is the process how something is happening in your body, how heart failure is occurring in your body, what is causing diabetes, what is causing this. So this is all comes under physiology. The first is your nutrition, elimination, mobility, palliative care, hygiene, rest and comfort intervention, and the most important thing over here is your pharmacological and parental therapy. Can anyone tell me about pharmacology? Like, what do you mean? You must be knowing about pharmacology as you have passed on India. Do you know any drugs which is very easy for you to understand. Any classes of drug that you know till now. Rupa, now you're
Steroid.
getting it completely.
Steroids,
Yeah, steroids, very good.
antibiotics,
That's good. Next,
IV fluids, parenteral nutrition,
steroids you know about, and
antibiotics,
antibiotics, very good. You know about
fluid,
antibiotics. You know about cardiac drugs,
yeah,
OHAs,
Stamina.
antipsychotics.
digoxin,
Yeah, very good. You know about digoxin. That's so good. Good. So you
calcium
should know
channel
about
blockers.
drug calculation. Listen, if you are appearing for your RN exam, there is a very less chance that you will get any questions on drug calculation. There's very like 1 or 2% chances that there will be a drug calculation, because drug is mainly given by LPN. So in your LPN license, you will get a drug calculation, but it's a very low chance that you get in your NCLEX exam. Next is your adverse effect. You should know adverse effect. I will teach you by mnemonics, but at your end, you should know them. Next is your safe medication. Where to give IV, IM for. What does PO stand for, anyone?
Per oral.
Very good.
Oral.
Per oral. Yeah. Can you give aminoglycosides per orally? Can you give aminoglycosides as oral medication? Anyone of you?
Glycoside. No idea. But it will affect the ears.
Yeah. Sorry, Rupa ji.
I think it affects the ears. I don't know.
Yeah, it does affect ears, but I'm asking, can you give your aminoglycoside as oral? Rupa, where you belong from? I'm just so sorry, I'm asking in between. Which country you are, like which state you are from?
I'm from Andhra Pradesh.
Okay, from Andhra. Okay, cool. Next is your, no, aminoglycosides are not given orally, only in two conditions that I will let you know it's given orally. Next is your blood product. You should know what is WBCs. You should know about your like WBCs, your RBCs, your platelet. What does TPN stand for? Anyone?
Total parenteral nutrition.
Very good. You should know about total parenteral. What's parenteral means? Enteral means GI. Parenteral means away from GI. If you're giving in your percutaneous, okay? This is your TPN. Drug interaction and emergency medication. Emergency medication, you should know them by heart. I will make you learn them.
Loading dose.
Easy. Next is your reduction of risk potential. Like, you should know about lab value, you should know about potassium, you should know about sodiums, you should know about your calciums, magnesiums. Do you know about all these things, Rupa? Like basics,
Yes.
should know about them. Very good. Should know about neurology. You should know about GCS scale. What is EVM? Anyone can tell me about EVM? Array, in GCS, we have 3 scoring. I, verbal and motor. I is for 4, verbal is for 5,
Okay.
motor is for 6.
Motor
Total
is
is your
6.
15.
15.
Remember it now? If we remember it by
Yeah,
the
yeah.
knowledge called EVM.
Yes, ma'am. Yes, ma'am.
Be very
Yeah.
clear about your basics, okay? You should know about your basics.
Yes,
Next is your vital signs. Can tell me about a normal vital signs first of all. Then we will go with the complicated one. What are normal vital signs? What is a normal BP?
120/80.
Oh no,
Pulse is
I need in a range. Whenever you're just telling about vital signs, you should know them in the range. Okay, before this, can anyone tell me what is BP? What do you mean by BP?
blood pressure.
Pressure of the blood.
Just not BP. Listen, you are not going to give me vague answers. Everybody knows BP stand for blood pressure. Even if I ask a 3-year-old my niece, he's going to say this BP is blood pressure. No, as a nurse, what should you know about BP? Like, what should you know? What is BP?
Pressure of blood exerted on the walls or our nerves.
Yeah, this is BP. You see, your BP is your stroke volume into your systemic vascular resistance. Okay, listen, what your heart, what is stroke volume? Cardiac output into heart rate. Yeah,
Heart rate.
this is your stroke volume, and If you combine this, your BP will become as cardiac output. Cardiac output, the amount of blood your heart is pumping in 1 minute, is called cardiac output. What is heart rate? The number of times your heart is beating in 1 minute is your heart rate. What is systemic vascular resistance? What are the pressures of your arteries that is being? If there is too much pressure, very constricted, there will be too much pressure. If you increase the volume, the pressure will be decreased. So your systemic vascular resistance. So by combination of these three, you have your BP. BP is your cardiac output into your heart rate into your systemic vascular resistance. Now understand the thing. Whenever anyone will ask you what is BP, never say just BP. Just say it is your cardiac output into your heart rate into your systemic vascular resistance. Understood?
Yes, thank you.
Yes,
If
ma'am.
this makes clear, I will make this thing more clear when we study about cardiology. But for now, I think it should be clear for your end. Can we start next? What are the things that you need to know? You should know about your post-op care. Okay, listen, tell me what is the most threatening thing that happens in a patient when the patient is post-op?
They
Infection.
might get respiratory arrest and bleeding.
Yeah, very good.
Hemorrhage.
Bleeding. Bleeding is your
Check
right
input output.
Yeah, input output. Yeah, very good. I want more answers. Like I want more people to answer this thing.
Infection.
Sorry.
I think after operation, the 24 hours are called post-operative care. So we can check first of a surgical case, then we check bleeding amount, color of bleeding, color of blood. Then input output check, then respiratory rate
Very good.
or
But
respiratory difficulty.
yes. Overthink our
Consciousness and orientation.
Sorry, ACEs?
Consciousness and orientation.
Yeah, conscious and orientation because after coming from the OT, the patient is already in your
Bearing of anesthesia.
and then there is anesthesia induced delirium also. So we will check the consciousness of the patient. But in your NCLEX, you have to keep bleeding in your priority. Post-op patients are your priority one. Next is your early symptom identification. You should know if there is a patient, he has a fracture. Imagine there's a patient, he have a fracture of a femur. After 1 hour, the patient start showing respiratory sign and symptom. For example, patient is having difficulty breathing. There is so much congestion, and this all the sign and symptom related to respiratory. Is this your patient priority?
Yes.
Sorry, anyone can answer me? Like, one
Yes.
thing, is everyone comfortable in English?
Yes, ma'am.
Honestly, tell me.
Yes, ma'am.
No, it's not about this and this because I cannot see everyone's faces on the screen.
Yes.
So it's better
Yes.
to yes.
Yes,
I want a verbal answer. Okay.
English.
Okay. Yes.
English.
Listen, if I ask you in sign language, answer me in sign language. If I ask you in English, answer me in English. If I ask you in verbal language, so you have to answer me verbally. Okay? Okay, very good. Okay. Apart from your bleeding, and afterwards your SSRI, that is your SSI, surgical site infection is your bracket. Okay. Next is your symptom identification, and next is your physiological adaptation. How your physiology adaptation? What is chronic? What is medical emergency? You should know about shock. You should know about MI.
Ma'am,
Always
surgical sign. Repeat. Is a surgical site.
surgical site infection is like it's a complication. It is an what do you call it? Like nosocomial infection kind of thing.
Nosocomial
So,
infection.
yeah, kind of. So whenever there's an
Formation
infection,
in the bone.
understand, listen.
After surgery.
If there is just imagine this is the abdominal and this is the navel, and understand there has been an appendectomy. Okay, this is there is a incision which is made over here. The incision which is made during your surgery it is also called wound. Understand, this is a very sterile, it is clean. Okay, there is no germination of bacteria over the side. But after some time, just imagine like after like one or two days, there's a pus accumulated to this area, there's oozing, there's bleeding. So this means that this This has been act as a portal of entry for the microorganism to grow over this area, and this has led into an infection. This is called surgical site infection, and it occurred due to the healthcare discrepancies. The healthcare workers are not working properly. That's why the patient got infection. Okay, understood?
Yes, ma'am.
Yeah. Next, we have after this your electrolyte imbalances. Okay. Next is your respiratory, endocrine, and renal. So this is all your topics which we are going to cover in your upcoming video. Okay. Next, we have studied about this thing. Okay. Okay. iPhone, may I know you're from which part of this country?
I'm from Punjab, Ludhiana.
Okay, working in which hospital currently?
Currently, I'm in AIMS Bathinda.
Okay, what name's Patinda?
Okay.
Okay, good. So which college you work from?
Actually, I have done BSc from SPMC Medical College. It's in Bikaner, Rajasthan.
Okay, yeah.
Yeah.
I have so many friends from Rajasthan who cleared their aims in first. So congratulations.
Yeah. Thank you, ma'am.
Okay. So today's topic, like now for till now we have discussed about your what is NCLEX, okay? How you can appear in NCLEX, and I cannot see anyone on my screen. Where have you all been lost? Class? Yeah. So we have talked about NCLEX. We have talked about NCSBN guidelines. Okay. So now you're aware of what all content that you need to study for your NCLEX exam. Okay. Next and the foremost topic of today's is your A, B, G analysis. Now, everyone on my screen, so I can teach you in one go. You're not having problem with it. Can I have everyone on my screen so I can teach you about ABG? This is very important. First class, first lecture, but very important.
Arterial blood gas.
Yes. Shushmita, screen on. Dhurmi, screen on. iPhone and Zoom user. Who's this Zoom user? Can I know? Zoom user. If you will not respond in 1 minute, I will remove you. And Dhumi also. Okay, you have a time duration of 1 minute. You respond to my call, otherwise I will remove you. Okay, so let's talk about ABG analysis. Before you study about ABG, you should know what is happening in your body. Okay. Understand, this is a graph. Over here, this is your lungs, and over here is your kidney.
Kidney.
दो चीजें बॉडी में, लंग्स में और किडनी में, दोनों ने मिलकर क्या कर लिया, आपके पीएच को बैलेंस करके रखा हो. ठीक है. वन साइड इज योर कार्बन डाइऑक्साइड, अदर इज योर बाइकार्बोनेट. ठीक है, दो चीजें हैं, बाइकार्बोनेट, कार्बन डाइऑक्साइड, दोनों ने मिलकर क्या कर रखा है, पीएच को बैलेंस. अब हम बात करते हैं कि पीएच क्या होता है ना. अब अगर समझते हैं कि पीएच इज योर, व्हाट इज पीएच. हम सब सुनते हैं कि पीएच होता है क्या, पीएच क्या होता है. Who have studied chemistry? Basic chemistry.
It's the
Acid-based
degree
balance.
of acid and base.
Okay.
Fever
So
is
Dhurvi, I'm
pH is
removing you.
basically power of hydrogen ions.
Very good. I want to know this answer. I was just waiting for someone to speak this one. Power of hydrogen ion. Oh, very good. So first of all, let me remove this person from the group. Yeah. Remove. This. I'm so sorry, just give me 1 minute. Okay. Okay. Now, who has said the power of hydrogen ion? Can I have on a screen? Can I know more about this power of hydrogen ion?
Sorry, I don't understand.
I'm saying you have told me the pH stand for power of hydrogen ion, right?
Yeah.
Yes. तो अब क्या होता है, अब मैं पूरी स्टोरी आपको सुनाती हूँ कि पीएच में ये पीएच 7.35 से लेके 7.545 आया कहाँ से, समझना है, समझो। देखो, योर ब्लड इज मेड अप ऑफ इलेक्ट्रोलाइट, यस और नो, एंड प्लाज्मा, आरबीसी, प्रोटीन, यस और नो। आपके ब्लड में क्या है, व्हाट इज योर ब्लड कंटेन ऑफ? योर ब्लड कंटेन ऑफ प्लाज्मा,
Plasma protein.
प्लाज्मा इज अ फ्लूइड. Nobody will, please don't interrupt. I'm not just strictly here. I know you know the answers, but when I give you a chance, please speak at that time, because I have so many thoughts in my mind. I need to put it on the paper. Understand? Your blood is made up of plasma, first thing. It is made up of hemoglobin. Okay. Hemoglobin. Globin is a protein, yes or no?
Yes, globin
Globin
is
is
a protein.
protein. Every protein has a negative value, negative charge. No, negative charge, basic chemistry I'm talking about. Then you have electrolytes, potassium, you have sodium, you have calcium. Okay. Then you have any more. You have magnesium, you have zinc. Anything else?
Potassium.
Phosphate,
Iron.
phosphate,
Very good. I want to
chloride,
know about this
magnesium.
phosphate. We have negative ones also. We have negative. We have phosphate. And you have all the
Magnesium,
globins. Okay.
chloride.
Very good. Chloride. We have negative also. Yes, very good. So what happened? Basically, you have a bridge. Okay. You have a bridge of, like, for example, if you want to study about pH, you need to know about your chemistry point of view. You should know about what is positive ion. You should know about negative ion. So in your blood, you have both. You have positive ions also. You have negative ones also. You have a chloride. What is the normal value of chloride? Around 110 something?
Yeah, it's 96 to 106 or 108.
Yeah. I will consider it as 110. Okay, remember it. Now you have a big sodium is 135.
Yeah, 135, 145.
Yes. Then you have very trans amount of magnesium. You have very trans
Yeah,
amount of calcium.
2.5
Yeah,
to
it's very
4.5.
trans amount of. But if majority, if you speak, you have more of a calcium in your negative and chloride. In your positive, you have your sodium. So
Sodium.
what is happening? If you will, okay, if you will, check your blood, some will have your positive ion and here you will have your negative ion. So there is a, in order to balance your positive and negative, there is an H plus ion. Okay. These hydrogen ions, which balances your pH, there should be a balance between a positive and there should be a balance between a negative. So who does this balancing? It does by your H plus ion, hydrogen ions. Somebody can take hydrogen ion, somebody can lose hydrogen ion in order to balance your pH. So how will you know this hydrogen ion? It's come from a formula. Okay, so let me tell you what happened. So the scientists went on some calculation and they found it out that the amount of hydrogen ion which is present in your body is 1, 2, 3, 4, 5, 6, 7, 8, 7. Point. This is the amount of hydrogen ion in your body. 1, 2, 3, 4, 5, 6, 7 point something like this. Something like this. Okay. So you cannot, every time you cannot read this value. Okay. So what they did, they converted this into your logarithm, log You know about log? Something, I'm talking about chemistry, basic chemistry we are talking about till now. So in order
Yeah,
to
it
do like
means
this,
we can say it's the power of something.
yeah, yeah, very good, very good. It's a power of something, but where does power come from? Where does pH come from? This pH come from your log. So
log.
they wrote a log 7. So 1, 2, 3, 4, 5, 6, 7. So they just shift this like this 10.40 and then one negative. And then this log, this will turn into 7.40. So this is the value which come from this all calculation. Now understood? I will repeat it again. If somebody has not understood, tell me right away. I will repeat it again also. तो मैं ये 7.40 आता कहाँ से? ये बहुत परेशान किया मुझको, ये 7 आया कहाँ से? फिर पता चला कि पूरा कैलकुलेट करके आया 7.40। हमने पूरे ब्लड में चेक किया कि हाइड्रोजन आयन है कितना, इसको हमने देखा कि तो बहुत ही कम हाइड्रोजन आयन है। फिर हमको एक वैल्यू चाहिए थी बैलेंस करने के लिए, तो हमने केमिस्ट्री अप्लाई किया, हमने एक वैल्यू लेके आए 7.40। ओके, एंड रेंज हमने निकाल दी 7.35 से लेके 7.45 तक आया थोड़ा बहुत। अरे
Yeah,
हाँ ना,
it's understood.
दो
It's
चीजें
easy.
होती। यस आईफोन जी। रूपा, actually I'm just teaching you because I want you to be very clear with your basics. Okay, without basics I don't want anyone to learn from me. Everywhere you will learn what is pH, but how this pH comes you should know what, you should know why, should know when, then you can be a very curious mind. Okay, iPhone, anyone? Rupa, if anyone
Yeah.
have a doubt I'm ready to explain it
No,
again, but
no,
please speak.
it's very simple. You can move forward.
Yeah, sorry.
Ma'am, it's very simple. You can move forward. It's understood.
Yeah, okay, thanks. So iPhone has taken a responsibility to speak for everyone's behalf. Now I don't understand that iPhone is the CR of the class. He will he will speak on your behalf now. Okay, cool. Okay, we have one more student, Preet. Please can I know, Preet, you are from where? And so if you will not be in my class, I will remove you in 1 minute. If you will not speak in my class. I really want serious student, so I can be seriously teach them. Okay, your time starts now. So till now we have studied about your pH. pH is your 7.35 to 7.45. Next is your bicarbonate. Okay, cool. Understood. Your bicarbonate is HCCO3. What is this H2CO3? Basically, it is balanced by your kidneys. Your kidney is the responsible for your bicarbonate. Normal value 22 to 26.
6.
Very good. Next is your partial pressure of carbon dioxide. What is this?
45 to
45
34.
to 45.
Very good. Can you remember these three values? Yes or no? Simple.
Yes, ma'am.
Yes,
Repeat
ma'am.
it again in your
Yes,
mind.
ma'am.
Just remember three values. Close this up. Tell me the values. Okay? Tell me the value.
pH is 7.35 to 7.45 and
Yes.
base is 26, 20 to 26 and the other one is
Very good.
from 35 to 45.
Very good. Okay, very good. Write rule number 1. What is rule number 1 state? Rule number 1 states that the normal value of pH is 7.35 to 7.45.
Hello, ma'am.
Yes.
I am want to tell something about my duty. It's 7:15, so I want to go my duty. Uh, can can I get this class later? I'm from Bangladesh and it's my duty time, so I want to go my night duty.
Where are
And
you,
I
Sushmita? Like, where are you
From
based?
Bangladesh. From Bangladesh, Dhaka.
Okay.
Priya ma'am,
If you
Yes.
permit, I want to leave
Priya,
this class right
can
now
you please
because I have
add?
night duty.
Shushmita, just give me a second. Yes.
Okay, can you please add Drumi? Actually, you removed her, so please add her. Drumi, and there is the another name is iPhone. So please add both of
Okay.
them. Yeah,
Um, I'm not getting it. Give me 1 second. Let me see this thing if I can see it over there.
so
Yeah. Give me
yeah.
1 second. Just give me 1 second. Can you ask them to just join it again because
They
they were
are
not telling me
trying
the name.
because once you removed, so they are unable to trying again.
Okay, understood now. Can you ask them to join with another ID?
All right. Okay.
Yeah, hold on. So where were we? We were on the topic called your rule number
Ma'am,
1. Yes.
can I leave?
Yes, Shushmita ji, you can leave.
Uh,
But come back soon.
but I will come back means I cannot join today. But I want to class recording if
You
possible.
will get a recording classes, but try to change your timing. So I don't want to.
Okay, I will. Okay, I
Yeah,
will.
yeah, you can leave. We can leave. Right, rule number 1.
Okay,
Rule number 1
good.
said that now no one will speak. Rule number 1 said that if your pH is less than 7.35, then it is acidic. And if your pH is more than 7.45, then it's
Alkaline.
basic.
Al-
You can call it basic. You can call it alkaline. Okay, means the same.
Alkaline.
Okay. Understand the exact pH is 7.40. Okay.
Yes,
So
ma'am.
if I give you a range that 7.35 to 7.45, then the exact pH will be 7.40.
Yes,
Anything below this is your
acidic.
acidic. Anything above
Acidic.
this is your alkaline.
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 Okay. Acis, if pH is 7.90, what you will call it?
Alkaline.
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 Very good, alkaline. Okay. If I say pH is your 7.41, what is this?
It's still normal.
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 Yes.
It's still normal, but it is still more than 7.40, then it's
But it's in between
normal,
range.
but
Yeah.
basic. Normal, but basic. You will call it normal.
Yeah,
There is no
normal
problem.
but basic. Okay.
But basics. Yeah, very good. Next, write rule number 2. Rule number 2 says that if pH and bicarbonates are in same direction, then it metabolic
Going
condition.
metabolic problem.
Very good. Metabolic condition. If not in the same direction, then
It's respiratory, or you can say pH is opposite to CO2 in
very
respiratory
good. I want to
condition.
listen to this answer. This is so good. A respiratory problem. But let me explain you this thing. It is saying that, okay, I will give you one formula. Remember this formula that your pH is inversely proportional to the carbon dioxide and directly proportional to the bicarbonate. This is the formula.
Okay.
pH is inversely proportional to the carbon dioxide and directly proportional to the
CO2.
yes.
And we also can remember this from ROM technique. Means respiratory opposite, metabolic equal.
Yeah, but I prefer you to learn it by this way. So I
Yeah,
want
yeah.
all of you to learn this way. Just remember this thing. If your pH and bicarbonate are in same direction, then it's metabolic condition. If your pH is inversely proportional to the, if your pH is more, if your pH and bicarbonate are not in same direction, then it's respiratory condition. Let me give you an example. Right? pH is your 7.21. Your bicarbonate is your 18. your partial pressure of carbon dioxide is your 40. Okay. Can you tell me 7.21? What is, first of all, make sure you are writing your
acidic.
normal values. No,
Acidic.
you will not jump. Listen to me first. You will write your normal values over here, 7.35 to 7.45. Bicarbonate is your, I'm so sorry, that's very hard. Okay, this is your pH. Next is your, what is bicarbonate?
22 to
26.
26.
Next is your partial pressure of carbon dioxide is your
35 to
35 to
45.
45.
Now you will compare this thing. Is this more than 7.35 or less than 7.35?
Less than.
Less than.
So you will make a down arrow over here. Understood? Understood?
Yes.
Yes, ma'am.
Next is your, look at your 18. 18 is more than 22 or less than 22?
Less than 22.
Less
Very
than
good. Less than 20.
22.
Make a down arrow. Your partial pressure of carbon dioxide is more than 40 or less than 40? Oh, sorry, more than
Partial
40.
CO2 is
Yes, I'm so sorry.
in between normal
Is-
range.
In between
Yes,
normal.
it is normal. Yes, it is normal. So what do you have to do? Apply rule number 1. What does rule number 1 state that? What you understand by rule number 1? Apply rule number 1 first.
Firstly, check for pH. Is this is this acidosis or alkaline? Then pH saying 7.21 is acidic pH. So condition is maybe acidic.
Very good. So this is your acidic. You have applied your rule number 1 and you found out that your pH is your acidic. Yes or no?
Yes. ma'am.
Now apply rule number 2. What does rule number 2 state?
Rule number 2 say that in
Say-
respiratory condition it's opposite to pH, and in metabolic condition it's same direction. And
Can you tell me, can you look at this pH and bicarbonate? Can you tell me, is this the same direction, opposite direction?
it's in same direction.
Same direction.
Now iPhone be mute. ACES. Is in same direction or in opposite direction?
It's in the
Same
same
direction, ma'am.
direction.
Everyone is becoming ACES nowadays. ACES.
Yes,
Is
ma'am.
this same or opposite?
It's in the
Same,
same
same.
direction.
So
Same
what you will
direction,
call
ma'am.
it as?
It's
Yes,
metabolic.
respiratory.
Sorry,
Metabolic
it's metabolic
acidosis.
acidosis.
ACES?
Isn't it respiratory?
No, it's
No,
metabolic.
no. iPhone be mute. I understand that you know the answer, but let me explain this answer to him. Okay. So ACES, understand this thing. What do you understand by rule number 2? Can you just tell me the rule number 2?
Bicarbonate and pH in the same direction.
No. ACES, you need to unmute
Eh.
yourself to speak.
It says if they are in the same direction, then it is metabolic,
Yes.
and if they are in opposite, then it is respiratory.
So can you tell me, are they in the same direction? They are both are going in downward.
Yes,
Are they in
yes.
same direction?
Yes, they are in same direction.
So what you will call it
Yes.
then?
It will be metabolic acidosis.
Shashikala?
Yes, ma'am.
Shashikala ji. Now you understand why it's metabolic?
Yes, ma'am. I
Rupa?
understand the
Yes,
this is the
ma'am.
metabolic acidosis.
Yes. iPhone? Yes, you know this thing. Preet? Can you reply, Preet?
Yeah, its condition is metabolic acidosis.
Yes, thank you. And okay, now let's jump to rule. No, give me one more example. I'm giving an example. You are going to tell me the answer. Rupa will tell me the answer. Okay.
Yeah.
pH is 7.450. Bicarbonate is your 19. And your partial pressure of carbon dioxide is 33. Rupa will tell the answer. I'm warning you. You have to write your normal values. And then you will compare it. If you're not writing your normal values, listen, it has been so long for me to teach the same topic, but every time I do the question, I write my normal values. So do not think that you know it and you will not write it out. This is the rule. You have to follow the rules. Write down the normal value, then compare it. Tell me which condition is this.
So this is 7.50 is alkaline and it goes
I
up.
don't know. You have to go like this, man. Normal value of pH is 7.35 to 7.4. As pH is
Oh,
7.40, then I will make an upward arrow. It is called as alkaline because pH is more than 7.45. This is how you tell
yes.
the answer.
Okay.
Then we will know.
Okay, the pH value, normal value is 7.35 to 7.45, but the value I got is 7.50. So it is alkaline. The arrow goes up.
Very good.
And
Just now stop. It is more. You have to make an arrow. You have to lie it is as alkalosis. Now, Shashikala, now tell me about bicarbonates.
Bicarbonates going down. Bicarbonate normal value is 22 to 26. Now I got the value, bicarbonate value is 19. So arrow mark was going down.
Very good. Now wait. Now apply rule number 3. Rule number 2. And tell me the answer. No,
Okay.
wait. You tell me about your carbon dioxide. It is normal, less than, what is this?
It's less than 35.
अच्छा जी, less than हो गया ये. Normal value क्या था carbon dioxide का?
साइड का था 35 to 45.
तो ये क्या है?
Less than.
Yes. Sorry. Less than ही है.
Going down.
Now you tell me. Apply rule number 2.
Says it is
Make it as like 38. Do not just write it 35. So it become easy for you. Now it's normal, okay? Apply rule number 2, ACEs.
it's metabolic it's respiratory
Why it's respiratory?
because they are going in opposite directions.
Very good. Then it's respiratory alkalosis.
Alkalosis.
Understood? Write rule number 3. Write rule number 3. If पहले सब लिखेंगे फिर मेरी बात समझेंगे, ठीक है? ओके, सबने लिख लिया? Okay, now understand what this is happening in your body. In your body, you have two systems working together in order to balance your pH. For example, if give me 1 second, please. audible? Hello? Hello, class?
Yes, ma'am.
Yeah, just give me 1 second. There was a network discrepancy over here. Just solve this thing. I will get back to you. Okay. Cool. Can you all listen to me now? Can you all hear me and see me at the same time?
Yes, ma'am.
Ma'am.
Okay. Good. Okay. So let's jump to this topic. So what is happening in your body? I was teaching you about your okay. 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 So what is happening in your body? Your body produce a waste which is called HCO3 negative. What does your body produce?
HCO3.
It is produced by
Yes.
kidney in order to balance your pH. So what happens whenever you have like HCO3 negative combined with H plus ion, it has a negative charge, it has a positive charge. So it can combine together, simple basic. So this can form as H2CO3. Okay, understood. So
Yes, ma'am.
now this happened. Okay, next understand this is all happening in your kidneys. Okay, so for example, imagine your body has too much of positive ions. If your body has too much of pH, like for example, your body is producing too much of hydrogen ions, okay, then what will happen? The more of them will combine to H2CO3 and they will form H2CO3. Oh, what is this? Okay. If your body produces too much of H plus ion, it will combine with this element and it will become a stable form that is your H2CO3. Okay. This is
Yes,
happening
ma'am.
in your kidneys.
Kidney.
Yeah, this is happening in the kidneys. Next, what is happening in your lungs? In your lung, you have this S2 water. Yes. In your blood, you have water, simple water,
Yes.
and you have carbon
Yes,
dioxide.
ma'am.
So what happens
Yes, ma'am.
when you will add these 2, 3, like
HCO3.
sorry, yes. So you can make it a H2CO,
H2CO3.
H2CO,
CO.
CO2. Okay. No, we have 2 oxygen.
CO3.
CO3, yes.
Yes.
It will combine as H2C. So understand, this one is also making this element and this thing is also making element. Okay. What happened? If this will break down, you can also break it down as H2CO, no, SCO3, H2CO2 negative also, and plus H plus ion. No, let me explain this thing again to you. Okay. Here, this your carbon dioxide is combining with your water and forming as H2CO3. Yes or no?
Yes, ma'am.
And this can further be divided as H2CO, CO3 negative and S plus ion. Yes or no?
Yes, ma'am. Yes, ma'am.
Understand, if you in your body you have too much of H plus ion, then what will happen? More of H2CO3 will combine with this and they will form an H2 and then they will form carbon dioxide, CO2 and water and this carbon dioxide will go out of your lungs? Yes or no? You can remove
Yes,
this
ma'am.
carbon dioxide in your body. And simple. This is so simple. Like what is happening in your kidneys? You have to understand this thing. This I know you can. I can teach you in your like with rules also, but you have to understand what exactly happening in your body. For example, you got too much of hydrogen ion. Okay, then it will combine into bicarbonate, and they will form this mixture, and this mixture will convert into CO2 plus H2O, water. You can remove this carbon dioxide from your lungs. Indirectly, you removed your H plus ion from your body. So this is how you balance your pH. आया समझ में कि दोबारा बताऊं? दोबारा बताऊं. That's why everyone is blank on my screen. If you understand the concept, I can teach you with mnemonics, but I want to understand the concept. Understand. First of all, you should know that one thing you should know that your pH depends upon your hydrogen ion. ये मैंने पहले बता दिया. पता ना, pH is power of hydrogen ion. You have to just balance your hydrogen ion in your body. Simple is this. Okay. So what is happening? How your bicarbonate and carbon dioxide is working together and balancing your pH. You should know about it. Okay. So what is happening? Understand, if you have too much of hydrogen ion, this will combine with H2CO3 negative. This is producing by kidneys as a waste material. Okay, kidney produce this element as a waste material. When it combined with your hydrogen ion, it will form a element called H2CO3. Okay, simple.
Yes, ma'am.
This can further be divided into carbon dioxide plus water.
Yes,
If
ma'am.
you can directly remove this carbon dioxide from your lungs, है ना, सांस लेके सांस निकाल सकते हो. तो क्या हुआ? इनडायरेक्टली तुमने क्या किया? हाइड्रोजन आयन को निकाल दिया अपनी बॉडी से, है ना? आया? दोबारा बताओ.
Yes, ma'am.
हाँ, सिंपल था. हाइड्रोजन आयन आपकी बॉडी में ज्यादा हुआ, किडनीज ने क्या किया? इसको बाइकार्बोनेट के साथ लिया, बाइकार्बोनेट में बनाया इसने, और इसको आपके लंग से बाहर निकाल दिया, है ना? अब मान लो उल्टा करते हैं, आपकी बॉडी में बहुत ज्यादा कम हो गया, हाइड्रोजन आयन बहुत कम है, हाइड्रोजन आयन बहुत ज्यादा कम है. Then what will happen? Carbon dioxide you will take more carbon dioxide from your lungs. ज्यादा कार्बन डाइऑक्साइड लेंगे, फिर हम क्या करेंगे? इसको H2CO3 में बताएंगे, और H2CO को बोलेंगे कि तुम ब्रेक करो इसको H2CO3 नेगेटिव में, और इसको आप अपने बॉडी में इसको लिबरेट करो, है ना? दोनों तरफ से चल रहा है ये रिएक्शन. बहुत आसान है इसको समझना, बट क्रिटिकल समझ सकते हो तो बहुत अच्छी बात है. आपकी बॉडी में अगर बहुत कम पीएच, हाइड्रोजन आयन बहुत कम है, हाइड्रोजन आयन बहुत ज्यादा कम हो चुका है आपकी बॉडी में, तो आप क्या करोगे? ज्यादा कार्बन डाइऑक्साइड लोगे अपने लंग से, उसको कंबाइन करोगे H2CO3 में, और उसको लिबरेट कर दोगे HCO3 नेगेटिव और H प्लस आयन में. फिर आपकी बॉडी में क्या आ जाएगा? H प्लस आयन बढ़ने लग जाए. वही अगर H प्लस ज्यादा है, कंबाइन करो, कार्बन डाइऑक्साइड बना के बाहर निकाल दो. है ना? दोनों कैसे बैलेंस कर रहे हैं? ये इजीली आपकी बॉडी से किडनी से निकल जाता है, और इजीली आपकी बॉडी से लंग से बाहर निकल जाता है. अब रूल समझते हैं, जो मैंने रूल लिखवाया था आपको पहले. मैंने लिखा है क्या है? If all three values are abnormal, then it's partial compensation condition. Understand ये होता कैसे है? ये होता है ऐसे कि जब आपकी बॉडी में मान लो पार्शियल, ऑल थ्री वैल्यूज क्या है आपका? पीएच, कार्बन डाइऑक्साइड एंड बाइकार्बोनेट. आपकी बॉडी पीएच भी इम्बैलेंस है, कार्बन डाइऑक्साइड भी इम्बैलेंस है, बाइकार्बोनेट. कार्बन डाइऑक्साइड मतलब लंग्स, बाइकार्बोनेट मतलब किडनीज. इसको समझने की जरूरत है कि आपका ना पीएच एक बच्चे की तरह है, पीएच एक बच्चे की तरह है, और किडनीज और आपके लंग्स एक पेरेंट्स की तरह, एक फादर है एक मदर है, दोनों बच्चे को संभाल रहे हैं. मान लो पीएच खराब हो गया, बच्चा बिगड़ रहा है, तो क्या करते हैं? पेरेंट भी, मम्मी भी डांटती है, पापा भी डांटते हैं, तो क्या दोनों हेल्प कर रहे हैं बच्चे को डेवलप करने के लिए, दोनों अपना अपना कंपनसेशन दे रहे हैं, है ना। यहाँ से ना कार्बन डाइऑक्साइड भी लगा हुआ है कि अरे इसको नॉर्मल वैल्यू में लेके आओ, इसको नॉर्मल वैल्यू में लेके आओ। यहाँ से लंग्स भी लगा हुआ है बाइकार्बोनेट की, इसको नॉर्मल पीएच को नॉर्मल वैल्यू में लेके आओ अपने H प्लस आयन निकाल निकाल के। अब क्या हो रहा है, जब तीनों ही वैल्यू अब नॉर्मल है आपकी बॉडी में, तो क्या होता है पार्शियल कंपनसेशन, मतलब कंपनसेशन तो दोनों कर रहे हैं बट थोड़ा थोड़ा कर रहे हैं, किडनीज भी कर रहा है, लंग्स भी कर रहे हैं कंपनसेशन, बट क्या कर रहे हैं थोड़ा थोड़ा कर पा रहे हैं, पार्शियली कर पा रहे हैं, पूरी तरीके से कंपनसेट नहीं किया है। क्या बोलते हैं इसको, पार्शियल कंपनसेशन, यस और नो, आ समझ में। राइट एन एग्जाम्पल, example says that pH is 7.48, partial pressure of carbon dioxide is 31, partial pressure of bicarbonate is your 21. Okay, rule number 1, apply rule number 2, then apply rule number 3. I want Preet to answer me, and Muhammad Usman and Farad Ahmed, please may I know you, where are you from?
It is respiratory and respiratory alkalosis naturally compensated.
I'm so sorry, Farhan. I cannot hear you. I cannot see you also at the same time. Please just unmute yourself and open your camera. Until now, Shashikala, Asas, and Rupa, answer me quickly. Normal right values. I will ask one by one. Farhad, can I have you on my screen? Muhammad also. Can you tell me how did you end up to this answer, Farhad? Farhad Ahmed. If you will not speak, I will remove you. Muhammad Usama. Okay, cool. Okay, tell me, Sashikala, rule number 1 and answer me this question.
pH normal value is 7.35 to 7.45. Now I got the value was pH is 7.48. Now is alkaline. pH is value is alkaline. The
That's full estimate. Aces 2, second.
Second, it exceeds the value of partial carbon dioxide, that's above 26 and it's 31. So they are in the same direction. That makes
I
them.
think the normal value of carbon dioxide is 35 to 45, no?
Yes, sorry.
Yeah. Apply.
Yes,
I told you, write a normal
it's
value, then answer this question.
yes.
Say rule number 2.
According to rule number 2, if it's in the same direction, then it's metabolic, and if it's in the opposite, then it's respiratory. So they are in the opposite
No,
direction.
tell me it is up or down.
It's down.
Okay. Opposite direction?
Yes, ma'am.
No. You have to see this pH and partial bicarbonate.
Okay.
Yeah.
Okay.
Aces. Hold. Rupa. ना जी ना, समझ में तो बिल्कुल नहीं आ रहा है मुझे, अनम्यूट करोगे तो ही समझ पाऊंगी मैं। भूल जाते हो।
Sorry, I was on mute. I was talking. So the normal value is like 26 to 22 to 26, and I got is 21. So it is the arrow is going down. It is acidosis.
Then ये भी ऊपर जा रहा है, ये नीचे जा रहा है, अपोजिट डायरेक्शन है दोनों का। रूल क्या कहता है? एक पार्शियल प्रेशर ऑफ कार्बन पार्शियल your bicarbonate and pH are in same direction, then it's metabolic. They're in opposite direction. You will call it respiratory.
Respiratory.
Respiratory
Apply rule number
alkalosis.
two. Apply rule number 3. Can you see all these values are abnormal?
Yeah.
ACEs. What will be the answer?
Respiratory alkalosis with
Versus
the partial
compensation.
partial
compensation.
compensation condition.
Compensation.
Partial compensation, respiratory alkalosis.
Alkalosis.
Now you got the answer. Partial
Yes, ma'am.
compensation, respiratory alkalosis. Understood?
Yes,
You
ma'am.
understood how your pH is, your carbon dioxide is acting together and making this happen. Ask me. Very good. Now understand rule number 4. This will be the I will teach you these all conditions today. Okay, then we will end this condition. If you want break, I can give you a break. So do you want to have a go on a break first? Let's take a break for. It has been how much time we have started the classes? 1.5 hours. Yeah. Let's just do one thing. I'm giving you some question. You're going to do this thing in your break, and you will come back after 15 minutes. Your pH is 7.48, 7.49, 7.0. Bicarbonate HCO3 is your 22, 20, 39. Carbon dioxide is 45, 40, and is your okay. Solve these
34.
questions. Come back after a break. Okay. Let me pause. Now can I have everyone on my screen? Class, you have to tell me, ma'am, you are not being audible to us. I was keep on speaking for so long. Is I'm audible now?
Yes, ma'am, you are audible.
Okay, good. Can anyone tell me the rule number 1? Rupa, what is rule number 1?
I'm still doing, ma'am.
No, I'm asking
I'm
rule number
sorry.
1. Simply, I'm just, I know you were busy eating, but tell me what is rule number 1?
Same direction. If
No, Rupa, that was rule number 3. What was the first rule?
If the less than 7.35 means that is acidosis. The pH was 7.45 means more than 7.45 means alkalosis or base.
Normal pHs?
7.35 to 7.4.
The normal exact pH is 7.40. Okay?
40.
Understood? Okay. What is
Yes.
rule number 2? Rule number 2.
pH and bicarbonate aroma going to the same direction. That is metabolic. When both are going opposite direction means that is respiratory.
Yes. Very good. What is rule number 3? Farhan, are you writing everything? You have to write it down, okay? And then now you will tell me the answer. What is rule number 3?
If the three values are going abnormal means that is
If,
compensation.
very good. If all 3 values are abnormal, then it's
partial
compensation.
partial
Okay.
partial
Partial
compensation.
compensation.
Okay.
Yes, ma'am.
Farhad, here's a question for you. Just write pH is 7.50. Okay. Your bicarbonate is 49. Your HCO3 is your 70. Can you tell me the answer now? Farhad, you need to unmute yourself first and then in order to...
Yes, ma'am. I'm saying. Ma'am, first of all, pH is alkalotic. It is, ma'am, metabolic, partially compensated.
No, Bache, I'm asking Just do one thing. In your left-hand side of the notebook, write the normal value of pH. What is the normal value of pH?
7.40. 7.35 to 7.45.
What is the normal value of carbon dioxide?
35 to 45.
Very good. What is the normal value of this?
22 to 26.
Very good. Now tell me rule number 1.
Number 1 is the pH value. It is about pH value. pH value is 7.50. So that means it is alkalotic.
Yeah, it is alcohol. So you're going to
Yes.
make an arrow
Yes,
outward.
it is alkalotic.
As the normal pH is 7.35 to 7.45, in my given question, the pH is 7.50. It is more than normal. Then it
Alkalotic.
is alkalosis. So I will write alkalosis, right?
Yes.
What is rule number 2? No, okay. Tell me the normal value of carbon dioxide. It is more than or greater than.
When it is 35 to 45. Here it is 49. That means it is
No,
acidosis.
no. Carbon dioxide. Bache, I'm talking about carbon dioxide, no?
Yes, 35 to 45. Ma'am.
Yeah. It is more than or less
Yeah.
than.
It is more than, ma'am. It is acidosis. 49. Acidic. It is acidosis.
No, bache. What you have, no, do not apply rule number 2 right now. I'm just saying, you have to correlate these two data and you have to tell me it is more than or less than. Simple. You don't have to apply any kind of
More
rule
than.
now.
It
Yeah,
is
it is
more
more
than.
than. More than. Yeah, this is 49 and this is more than. You're going to put an arrow over here. What is this?
HCO3, ma'am, it is normal value of 22 to 26. And it is also more than.
Yeah. Now apply rule number 2. In first step, you have to mark them. Is it more than or less than? You have to put an arrow. In next step, you have to tell me whether it is more than. Now apply rule number 2. Bache, Farhad, what is rule number 2?
Rule number 2 is, ma'am, carbon dioxide is 49, which is greater than 49, 40, which is greater than 45. That means it is in acidosis. It is in acidosis state.
No, bache. You have to look your
Ma'am,
pH and this is your
ma'am, I joined.
bicarbonate. You have to look, is your
joined.
pH and bicarbonate are in same direction?
Yes, they are
What
in
is the
same
rule number 2
direction.
written? Bache, rule number 2, what is the rule number 2 state this? Rule number 2 say that if pH and bicarbonate are in same direction, then it is metabolic. Okay? You have to see, is your pH and your bicarbonate are in same direction?
Yes, ma'am, they are in same direction.
Very good. Then it will be metabolic or respiratory.
It will be metabolic.
Very good. Then you're going to write it like this, metabolic alkalosis. Okay? Understood? Till now you understood? Now tell me your rule number 3.
Ma'am, I joined the class late. I don't know the rules.
I know. I'm just, that's why I'm doing questions with you. I'm not forcing you. Okay. You have to tell me, ma'am, can you tell me the rule number 3 again? Okay, it say that
Yes.
if all 3 values are abnormal, then is partial compensation. Okay, write it down and tell me. If all 3 values are abnormal, then is partial compensated. Okay. Can you tell me, is all these things are abnormal?
Yes, ma'am.
So what you will call it as?
It is ma'am, metabolic alkalosis partially compensated.
Yeah, you can also write a partial compensation metabolic alkalosis, or you can also write a metabolic alkalosis partial compensated. Is this clear till now? Everyone?
Yes.
Yes or no? Yes.
Yes, ma'am, it is clear.
Yes, ma'am.
Yes, ma'am. Breathe. Okay, there are 2 type of clear. Clear means erase करने वाला clear, and दूसरा इसकी समझ में आया. तो ये कौन सा आप दिमाग से clear हो गया कि समझ में आया? इतना तो हिंदी आती है। फरहाद, इतनी हिंदी आती है? यस, ओके, चलो।
Yes, ma'am. What were you saying?
आई एम सेइंग, डू यू अंडरस्टैंड हिंदी?
Yes, ma'am. I can.
Yeah, it's good. Okay, I'm talking about rule number 4. Rule number 4 says that if pH is normal, this is rule number 4. Okay, if pH is normal, then it fully compensated. It is saying that if your pH is normal, if your pH is normal, and all, you don't have to look at anything else. You have to look at your pH. If pH is normal, then it's full compensated. Okay. Can I? Okay. What does it mean? It mean by basically your kidneys and your lungs have worked properly to make your pH normal. It means they have compensated. They had put their effort. They had compensated in order to make your pH normal. I'm giving an example. Write pH 7.37. Okay. Next is your partial pressure of carbon dioxide is 32. Next is your partial pressure of bicarbonate is your 20. Okay. Now, again, Farhad, tell me, what is this? What is normal value of pH?
7.35 to 7.45.
Very good. What is the normal value of carbon dioxide?
It is, ma'am, 35 to 45.
What is the normal value of bicarbonate?
22 to 96.
Okay. Can you apply rule number 1 and compare all these three values?
Yes, ma'am.
Yeah.
Normal.
Yes, very good.
pH
Normal.
is normal.
Yes.
Carbon dioxide is less than.
Yes. Yes. Next.
Going down.
It is more than or less than?
Yes. 20. It is
Simple.
also less than.
Very
It is also
good.
less than.
Okay. Now here comes the catch. Here comes the catch. Listen very carefully. I taught you normal value of pH is 7.35 to 7.45, but I've also taught you that exact pH is 7.40. Okay, so here comes the catch. 7.35, 7.36, 7.37, 7.38, 39, 7.40, 7.41, 7.42, 7.43, 7.44, 7.45. These are the normal ranges of pH. Yes? Yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Among them, your exact normal is the middle value 7.40. This is the exact pH. Anything which falls below is normal but acidic. Yes or no?
Yes,
Though
ma'am.
it is normal but acidic. Anything which is between these things are normal but slightly basic. Okay, if you look at the pH general wise, it will be slightly basic. Normal but slightly basic. So over here, though your pH is 7.37 is normal, you will consider it as normal, but it is less than 7.40, then you will make a down arrow. Okay, normal, but write it like this, normal but down arrow. Okay, now apply rule number 2. Farhad, apply rule number 2. No, Farhad, I can't, you're not audible at all.
Okay, ma'am. So the pH is in slightly acidic state and HCO3 is less than. So they both are same. They both are moving in the same direction.
Yes, very good.
Okay,
So
it
first
is
of all,
metabolic.
tell me this is acidic. Yes,
It is
this is
acidic, ma'am.
acidic. They're in
Yes.
same direction, then it's
Yeah, then HCO3. So
Metabolic.
it is, ma'am, metabolic
It is
acidosis,
metabolic. But
fully
your pH is
metabolic
normal, then it's
acidosis. Yes, fully
fully,
compensated.
very good. Fully compensated metabolic acidosis. Understood?
Yes, ma'am.
आया समझ में थोड़ा बहुत?
Yes, ma'am.
Yes, ma'am.
Yes. Okay. Again, let's do one more question. Okay. pH is 7 point. Who's going to tell me the answer? Take your time, tell me the answer very quickly.
Is that CO2 is 50 ma'am or 30?
It is 50, बच्चे, it is 50. 50. 50.
It is, ma'am, it is respiratory
hurry.
alkalosis.
Don't hurry.
Respiratory alkalosis partially compensated.
It is
Respiratory alkalosis fully
no.
compensated.
Rule number 1, rule number 2, rule number 3, rule number 4. This is how you have to move. इसके बिना जंप नहीं करना. आंसर पे नहीं जंप करना. आंसर पता लगाना हमारा काम नहीं है. हमारा आंसर है कि समझना क्वेश्चन को. पहले समझो. पहले नॉर्मल वैल्यू लिखो साइड में. कंपेयर करो.
Yes,
एरो
ma'am.
डालो.
pH is normal but slightly high, so it is in alkalotic state. And HCO3 is lower than 22. That means it is in acidosis state.
पहले ये लिखना होता
And
है. पहले नॉर्मल वैल्यू बताओ. उसके बाद दिस इज नॉर्मल बट हायर
slightly high
दिस इज
alkalosis.
lower end. This is higher end. Yes.
Yes.
Let me use a different pen to explain. Which pen do you like? Green? Yeah, let me go with green. So, rule number 1, you applied. You will call it as, it is more than, you will call it as alkalosis.
Yes, yes.
Yes or no? Alkalosis.
Yes,
Are these both direction? Opposite direction. Opposite direction. Then it's respiratory.
Respiratory.
Then you will look at this. Array, what was the pH? 7.44.
4.
Yeah. Then it's, though it is normal,
Fully
then you will call
compensated.
it fully compensated respiratory
compensated.
alkalosis. Are you clear till now?
Yes,
Yes,
ma'am.
Yes,
ma'am.
ma'am.
Clear hua? Okay.
Yes, ma'am.
Right. Rule number 5. Right. Rule number 5. Okay. Right. If one value other than pH is normal, then it's uncompensated. अब मैं इससे ज्यादा सुंदर नहीं लिख सकती हूँ. ये मेरी मोस्ट ब्यूटीफुल हैंड राइटिंग है. रूपा, you understand Hindi?
Ma'am, I can read and write and little bit I can understand, but I cannot follow so much.
It doesn't matter. I'm just saying it. I'm saying if one value other than pH is normal, then it's your uncompensated. इसका अर्थ क्या होता है? इसका मतलब क्या होता है?
तो मतलब ये है मैम, अगर कार्बन डाइऑक्साइड या बाइकार्बोनेट में से अगर कोई भी वैल्यू अगर नॉर्मल होगी और दूसरी एबनॉर्मल होगी, तो इसका मतलब है कि ये जो है अनकम्पनसेटेड है पीएच.
अब
किसी
इसका
दूसरी,
बोलो.
बस यही है, यही बोलो.
चलो अब समझो. देखो, it means that one value is normal. It means that one value is not changing at all. It is not putting efforts to make your pH normal. Then that's why it is uncompensated. That one value is not putting effort at all. That's why it's uncompensated. Okay. The other value is trying. Your carbon dioxide, your lungs is trying to make your pH is normal. So How does it change? It is changing by changing the concentration of carbon dioxide. Your lungs is regulating to make your pH normal, but your bicarbonate, that means your lungs is not putting efforts to make the pH normal. That's why it's uncompensated. Okay. For example, your pH is 7.13. Your partial pressure of carbon dioxide is 47. Your partial pressure of carbon dioxide, your partial pressure of carbon dioxide is 47. Your partial pressure of bicarbonate is your 26. Now tell me, it is less or more than?
It's more than that. pH is less and carbon dioxide is more than. But HCO3 is normal.
This
Yes.
is partial pressure.
It is
This
more
is
than.
more than. This
More
is
than.
normal.
It is not normal.
But if one value is normal, but your pH is normal, then it's
Uncompensated.
But first of all,
Uncompensated.
you have to apply rule number 1. You have applied rule number 1. Apply rule number 2. What does apply rule number 2 state that? What do you understand by rule number 2?
Respiratory.
No, बच्चे rule number 2 बोलता क्या है? क्या बोलता है? अगर pH और bicarbonate same direction में है तो metabolic. अगर pH और bicarbonate opposite direction में है तो
Bicarbonate, so
respiratory.
opposite directions respiratory.
So pH is your lower end, your bicarbonate is normal. अब हमें कैसे पता चलेगा कि ये metabolic है कि respiratory है? कैसे पता लगेगा?
Ma'am, respiratory and pH both are in opposite direction. Ma'am. That was right.
नहीं फरहाद, क्या बोला आपने?
मैं कह रहा हूँ कि ये देखने से पता लग रहा है
क्या?
respiratory has
देखो,
increased.
जो efforts
So
जा
that
रहा है
it
ना,
is
your effort is
acidosis.
being put in by your carbon dioxide. Then you will call it as respiratory
Acidosis.
respiratory acidosis,
Uncompensated.
respiratory acidosis. Why respiratory? Because only your pH is putting efforts. Sorry, your carbon dioxide is putting. Okay. देखने से पता लग रहा है. अच्छा आंसर था वैसे. Breathe. You have to open your camera, बच्चे. Rupa.
Yeah.
Shashikala. Okay. Did
Yes,
you
ma'am.
understand all the things? Can I recap again?
Yes, ma'am.
Yes, ma'am.
Okay. Rule number 1 state that your pH is 7.35 to 7.4. Anything which is less than this is your acidic. Anything which is
Acidosis.
more than this is your basic.
Alkaline.
Normal pH
Or
is
alk.
7.40. This was rule number 1. Okay. Rule number 1 says that your pH and bicarbonate are in
Same direction.
direction. Then it's
Metabolic.
metabolic. If opposite direction,
It's respiratory.
very good, it's respiratory. What does rule number 3 say that?
If all three values.
values.
If all 3 values are abnormal, then it's Farhad.
Partial compensation.
Very good. Partial
Partial
compensation. Rule number 4 state that if
pH is normal,
pH is normal,
Then it is fully compensated.
Then it's fully compensated.
If
it is normal.
if
one value.
one value is abnormal other than pH is your uncompensated.
Uncompensated.
Did you understood?
Yeah.
अरे रूपा जी पीछे कौन बोल
Yes,
रहा है
ma'am.
आपके?
No, that's not me.
And this is not your end?
I understood, ma'am.
Okay, very good. You understood. Now, Did you understood the rules by lungs, kidneys, heart, GI? बताओ, आपके दिल, दिमाग, GI, किडनी सबको समझ में आ गया है? आपके शरीर के हर एक अंग को समझ में आ गया है? Shashikala, did you understood it by joints?
Yes, ma'am.
Your joints, your neuron joints. I'm talking about these joints in your brain. Are you utilizing your joints? Are you
Yes, ma'am, I
producing
understood.
kinetic energy, electric energy over here? Okay. Did you understood? Did you connect the dots? Everything? Okay. Can you tell me what is metabolic acidosis? What is metabolic alkalosis? What is respiratory acidosis? What is respiratory alkalosis? What's your partial compensated, fully compensated, and uncompensated? Everything you understood? Okay. I will give
Yes, ma'am.
you questions today in order to practice for your ABG, and we are going to end the class today. Okay. So this was too much today. I know. So much we studied. In depth we studied. Thank you for the joining. If anyone want to give any kind of feedback, it is much appreciated from my end. Perhaps be on time from next. Okay. Yeah. Any feedback from your end? I would highly appreciate. Did you understood?
Yes, ma'am. You are teaching briefly, ma'am. In my first year they are teaching. It's not understandable, ma'am. It's now you are teaching. Wow, like a wow.
Thank you. Okay. Much appreciated that you understood my
in my
concept.
in my 5 years experience, I saw some reports in ABGs. Um, now my mind is recollecting. Okay, this is the report. Okay.
Yeah, this was a report. So whenever anyone in your
Yeah.
family member shows you ABG, you have to be very quick. You have to read everything. You have to tell me.
Yes.
Okay, now I
Yes.
know what is
Yes.
happening in the class. Yeah. Okay, before going to class, you need to understand how do you take your ABG sample. You take your ABG sample arterial. You have to collect blood from your arteries. And before checking your
Allen's
arteries, you have to
test.
do Allen test. Yeah.
Allen
Okay.
test.
You have to occlude your radial artery and your ulnar artery. And you have to see one by you have to remove one and then again and you have to see the blood supply. If there's no blood supply, you will not. Okay. You have to apply pressure after this thing. Okay. If patient is hemodynamically unstable, you will not take ABG analysis. Okay. Very good.
Yes, ma'am.
This was the first lecture. I hope you understood each and everything. In
Yes,
depth
ma'am.
also, what is pH, what is bicarbonate, how your lungs, how your kidneys are working together, you're synchronizing together. Okay, cool. Thank you so much. Anything else? Amrit, you want to say in class? If anything else you want to say, you can speak in class. Amrit, do you want to make an announcement?
Ma'am, if nobody
Yeah.
wants to talk, I need to say something. I'm a repeat
Yeah,
test
please.
taker. I got
Okay.
one question like a ABG. It says that if I mean the ABG doing the test is costly, so how can we like reduce the cost?
You can go for
That was the
if
question. I don't know the answer.
do you have any other options? Do you remember the options? But if you can't
The
go for ABG, then
options I thought like do Allen test.
no, why will you do it? Okay, no. It is asking a question related to the price point of view. So if the price is high, then you can go to VBG, that is your venous blood analysis. Okay. The only discrepancy you will find it in
Sorry,
Yeah,
ma'am.
you have to tell me the exact situation, basically. But okay, if there were an option of BVG, you can go for that. Okay. Okay, Allen test is done to assure the safety that there is a proper circulation of blood. Okay. This is another person. Okay. Okay, thank you, class. And want to share one thing. So we are building up the community. It's though it is free of cost, so I won't think I will be able to help you with your U world. So you have to make one group and you have to participate together. You have to just put small amount of money. So 5-6 people can buy together U world, and you have to start practicing. But you have to start practicing. I will give you a question. I will give you so many questions, but you have to practice at your end. Okay. Okay. Farhad?
This book enough for NCLEX exam, ma'am?
No, bache, no. You can read. I'm not stopping you to read this book, but this book will make you confused.
Make confusion.
Yes, it can cause confusion.
Okay.
You can
Okay.
study. I'm not stopping you. If you can understand, you can study. If you
Okay.
can't understand, don't. You try to read this book one or twice. But if you're unable to study it, do not waste your energy. Whatever I'm teaching is good. I will ask, okay, I might ask you to go to NCBS guideline to study more. Might ask you to go to NCBS or WHO or CDC. Okay, but do not rely on that book. Okay, completely do not rely on that.
Okay.
It's
Okay.
good. I'm
Okay,
not
ma'am.
saying it's not good, but completely devoting your time and energy. Because these topics we studied in 1 or 2 hours. Okay, but
Yes,
over
ma'am.
there it will take so much of efforts to study. Okay.
Okay. Okay, ma'am.
You want to say?
So what is the best resource, ma'am, to study?
What I think your best source is your question practice. No, nothing is best than practicing question before your exam. If you practice 85 questions for your straight 4 months, nobody in this world can fail you with this exam.
Multiple mock test, ma'am.
Yes. Every day, do 85 questions. Do 85 questions. You will want to
Okay.
pass.
Okay.
ऐसा नहीं होगा ना सेम क्वेश्चन बार बार कर दिया नहीं मूर्ख नहीं बनाना 85 बोला था रोज 85 सेम क्वेश्चन कर देता हूँ मैं 100% लेके आता नहीं डिफरेंट टाइप ऑफ बेस्ट सोर्स इज योर क्वेश्चन do not rely on books. You can go internet. There are so many things available. It's good, free of cost. There are so many good YouTube channel like Ninja Nerd, but they are very in depth. It will take your so many time to understand. You will actually you have to study from both. Start with your U world initially in group. Then you can go to Archer in group. Do not waste money. Participate together. Buy one U world. Share with 5 people. My student share with 5-6 people. Easily they access U world. And by God's luck, you are in the same different time zone. Then you will not have problem at all. Okay. Anything else you want to speak? Okay, very good. Thank you so much. And I don't know how much you pray to God, but whatever religion you are, whatever culture you are, one thing, remember one thing. Do not ask help from your God. Ask your God to stay beside you and to track you through your journey. Okay. Do not beg to God कि मेरे एग्जाम में पास करा दो नहीं आप खुद पास कराओगे. Nobody will help you. I will tell you this later point, but I'm asking you to trust God. Okay, trust whichever you faith, have faith, pray to it, be a good human being first. Okay, then only there is a motive to pass the exam. If you're not good human at being first, then there's no motive of passing the exam. Okay, you're cheating yourself. Be good person, be humble, be right, pray to God that please God sit with me while I'm studying. I'm truly studying. I'm not cheating myself. I'm not cheating to anyone. I am putting my efforts. You see, I am putting efforts. The results are in your hand. Okay. Okay, very good. And coming to Farhad question, listen, bache, I'm not stopping you to go online because they provide you excellent resources. I'm not denying this fact, but some of them is not worthful. So you might lose your so many time over there. But what I will teach you, I will teach you gradually from first to the last. In your YouTube, you can get so many different things. So they might hinder your studies. So once you are very much compatible, once you have studied with me for 1 to 1, then you will get what to study, what not to study. Then you will get a right resource. Initially, start with me, go stepwise, and then after 1 month, then you will have built a concrete ground to stand a pillar on. Then you can start with any other resources. Okay? Understood?
Yes, ma'am.
So let's end the class. I hope everyone has understood. They have something happening in their brain. I will give you questions. Kindly. Okay, thank you so much.
Thank you.
Thank you, ma'am.
Thank
you, ma'am.
you.